Hi, this is Gayle Palmer, the osteopath at the Living Elements Clinic. With all the coronavirus concerns at the moment, I wanted to show people how to keep their respiratory systems and their lymphatic systems working to the best of your ability, because that helps to prevent getting the virus, and then if you do get a virus of any sort, whatever sort of chest infection if you like, this will help you get over the effects of it and keep your lungs working as best as possible. So several things to think about with this. First of all, we need to keep your blood supply going to your lungs as efficiently as possible, and then enable your circulatory system to work as well as it can as well. The lymphatics help to drain a lot of the lungs too, so they're an important part to make sure is working, and they boost your general immune function. All of those are important. How we do that is work on the structure of our bodies in order to help the function. So I'm going to give you some exercises that will help you at home keep you well. So first and foremost, we're going to work on how our upper ribs and our lower ribs work. So our upper ribs have this type of tipping action that's very exaggerated. So we're going to use that natural movement and augment it, i.e. increase its function to help our rib function. Okay, so what we're going to do, we're going to use the pads of our fingers. We're going to put them either side of our ribs, so either side of our sternum, which goes down the centre here. And there's a little dip or a notch between each of the ribs as they're coming into the sternum. So we're going to put our fingers in each of those little notches. They're usually tender if there's not great drainage, so don't be surprised by that. We're then going to rotate firmly in those areas. Okay, you do that for about 10-15 seconds on each rib intersection, and then you move down to the next rib. It should be quite sore. Don't worry about that. Keep doing it. Over that 10-15 seconds, it will get less sore, and you will then know that you stimulated the circulation in those. So go all the way down the sternum and breathe as you do so. You get right down to the centre there. The lower ribs, so you've got 6 upper ribs right up at the top here. Most people don't think they have ribs up there. Down to here, those are your 6 top ribs. You then have your lower lip ribs, and they have this kind of an action. Okay, they're the ones we normally think of as our ribs. So because they have this action, you have to move in a different direction. So you can side bend, which will help to stretch out that line of ribs here. And you can augment that again by putting your hand and using this part of your hand on the side of your ribs and stretching over whilst you push down in this direction to try and prevent that rib from moving. So you're basically levering the rib above away from the rib that you're holding. Does that make sense? Great. So you can do that again and again. Again, you need to do it both sides. You will find when you're resisting that side bending movement that you are not able to rotate quite as far. That's fine. That's exactly what's meant to happen. For the very lower ribs, you've got 2 floating ribs, your 11th and 12th down here, and as you can imagine, they are not attached to the rest of the cartilage around your thorax. So these you have to work slightly differently. And the best way to do this, if your shoulders are good enough, is you hold just around here, either side of your spine. You can just about feel them. They're kind of slightly hidden. And you can side bend again to get those lower ribs moving. They're very important because they are used with your diaphragm, your huge muscle, which is right in the middle of your chest, but attaches to the rib margins all the way around to these 12 ribs. That is a vital part of keeping your lungs working, healthy, amongst all sorts of other drainage issues. So making sure that that works is vital. There are other ways that we can help to assist your rib function. And for this, you can get a length of rope, or you can get a broom handle. Okay, so we're going to take our rope, in this case, about shoulder width apart, and you can take it up above your head. This helps to stretch out the front of your chest, and because you're using your upper arms, it helps to particularly work the upper ribs as well. As you take it up, you breathe in. As you take it down, you breathe out. I'm going to show you that sideways on. And when you're doing this, you're going to be adding a little bit of extension to your back. The older you get, the more fixed and tend to be flexed over your back becomes, and that's not good for how your ribs function. So we need to try and get as much movement and opening into that space as possible. Here's another way to do that. This is a back stretcher, and I'll show you how to use this shortly, but most people aren't going to have this. Okay, it's fine, you don't need to have it. There are other ways to do this. Everyone has towels at home. You can roll them up into a tight roll. This is a smaller one, and you can make them however thick you want, and you will find with a little bit of practice what works for you. You could also use a yoga type roller, and the principle with this is that we're going to roll over individual spinal segments like this to gently encourage them into extension. Okay, so if I just take that to one side, and if you could come around slightly to the side, I'm going to pop this here on the table, lie down, and then you're going to gently lower yourself down so that you can feel your back stretching out over. If you've got a very fixed spine or you have a very curved neck, you're not going to be able to do this. You will need to support your neck in that case. Interlace your fingers behind your neck and gently allow yourself back into extension. And then when you've done a couple, move the roller up or down, or the towel, whatever you're using, and do that over another segment. If you have a chest infection, this may be uncomfortable. Don't worry, it means that you're beginning to open up those tight, inflamed tissues, and it will settle down. It's temporary, so don't worry about that. Okay. So you can do similar things, but that's easier to see on the video if you're using a towel of whatever size. You can also use a ball. This happens to be a slightly floppy yoga ball. And again, you can do exactly the same thing. It doesn't have quite such a point fixed position, but it works in exactly the same way. Now, ribs also allow rotation in our spines. And again, if we use the rope, we can help to be able to measure how things are. So this time you need to have the rope a little bit further than the shoulder width apart. You rotate round as far as is comfortable. Follow with your head in both directions. And breathe as you do so. As you breathe in, and as you come into the neutral, breathe out and breathe in. These exercises shouldn't take that long, 5 minutes maybe, but they will make a tremendous difference to how your lungs are able to function and the flexibility that you have. If you do have a chest infection, you may find they make you cough. That's fine, that's because your lungs are now working better and they want to get rid of the rubbish that's in them. I hope that that's been of value and is useful to you. You need to do these exercises if possible every hour or so. As I say, they don't take very long, but they will make a big difference to how long you get an infection for and how quickly you're able to recover and the health that you have as a result. If you need to get more information, please have a look at the website. It is livingelements.co.uk. And if you look up Living Elements Clinic on YouTube, you'll also find the information on there. Thanks very much for watching, and I'll see you soon.